My dear viewers, we have Dr. Sridevi with us. Doctor, can you share how to examine the breast? Sometimes doctor examine, sometimes self-examination. Can you share about examination of the breast, please?
Sure. So, thank you. Examination of the breast is very, very important. So, every girl should do a self-examination of the breast, and it should be done every month. So, every month usually at the same time would be preferable. So, same time means, like for example, after 2 to 3 days after your periods get over, that time, and every month it can be done around that time, after the age of maybe 30, or even from the beginning itself, we advise them to do a self-examination. So what do we do in a self-examination? What all do we need to see? So we have to see if both sides of the breast are looking similar. So one side is not bigger than the other side. We call that as symmetry. So if both sides look equal. So that is the first thing we want to see. Then we want to see if when you see, first we want to see, just look at the breast. So when you look any abnormality means any swelling which is visibly seen, or any color of the breast which has been changed, or any blood clot which has been visible, or the nipple, we call that. In the nipple, if there is any discharge or any cracked nipple, or if the nipple gone inside, we call that inverted nipple, or if there is any discharge from the nipple. So these can be done by just seeing at the breast. Next, we have to feel for the breast, whether the feel of the breast is equal on both sides. Usually it has to be soft, but sometimes what happens is it can be hard in certain places, or you can feel a lump. So when you feel a lump, it is very, very important to examine it properly, whether the lump disappears, or what is the size of the lump, whether it's a small size or whether it's little bigger, or do you feel it in both sides, or is it present only in one side, and whether it is moving, that lump when you feel it, whether it is moving, what is the consistency, or whether it is soft or hard, like that. Your doctor will do a complete examination, but you should be able to at least find out that something is abnormal. And same way for the nipple, again you have to see for all these problems. So it can be done in different methods. You can just lift your arms up and palpate, or it can be done on lying down also. So these palpatory techniques will help you find out if there is any, why this is important is if you have any mass or swelling of the breast, that is any lump, we want to detect it at an earlier stage itself. So that's why this self-examination has to be done. And if you find anything abnormal, then when you go to a doctor, they will do a complete examination of the breast. So they will check whether there is any ulcer in the breast, any infection or any wound in the breast, or any discharge coming from the nipple. If there is a discharge, what kind of discharge, whether it is any smell is coming from the discharge, or whether it is watery, or whether it's blood stained, or coming to the lump, how big is the lump, what is the size of the lump, so that we can know whether the lump is increasing in size or whether the lump is same, what type of lump, because mostly we want to detect breast cancer with this examination. So when you suspect anything, the appropriate investigations can be done, and it can be diagnosed at a very early stage itself. That's why the self-examination has been advised to be done by all women.
Yeah, in this they can divide the breast into 4 quadrants, and then very systematically they can palpate and see. And after delivery, possibly if there is anything, temperature, any like a feverish temperature, that means it's indicating for infection. That can be also, they can find out at early, and they can go to a correct consultant and they can get cured. Okay, so thank you very much, doctor.
Thank you.